How often should I really be seeing the dentist? For some people, it's every 6 months, no question. For others, it's only when something hurts. And for many families, it's somewhere in between with a lot of confusion mixed in. In this video, we're going to clear it all up. We'll talk about where the every 6 months rule came from, the biggest myths families believe about dental visits, and how often kids, teens, and adults truly need to be seen. Why waiting for pain is one of the most expensive mistakes people can make, and how dental visits should change as your family's needs change. We will also cover what happens during a routine visit and what doesn't, when you may need more frequent visits, and how preventive care actually saves time, money, and stress. By the end of this video, you'll know exactly how often you and your family should be seeing the dentist without guessing or guilt. So let's start by addressing the rule everyone has heard, but few understand. You've heard it your whole life. You should see the dentist every 6 months. But where did that rule come from? Believe it or not, it wasn't created because everyone needs the same schedule. The 6-month guideline became popular because it's a good average for cavity prevention. It allows early detection of problems. It fits insurance models. But here's the truth. 6 months is a guideline, not a universal rule. Some people truly do great on a 6-month schedule. Others need to be seen more often, and some healthy, low-risk patients may not need that frequency. The key is risk, not routine. And yet, many families treat dental visits like oil changes. If nothing seems wrong, we'll just skip it. That's where problems start. This is one of the biggest myths we hear. I don't need to go unless I have pain. Here's the issue. Most dental problems don't hurt until they're advanced. Cavities, gum disease, infections, and cracks can develop silently for months or even years. Pain usually means the problem is bigger. The treatment will be more involved and cost will be higher. Recovery is longer, and routine visits can catch issues when they're small, cheaper, and less invasive. Often reversible, skipping visits to save time or money often does the opposite. Prevention isn't extra care, it's smarter care. One size fits all does not work in dentistry. Let's break it down. For kids, teeth are still developing, cavities progress faster, and habits are forming. Regular visits help catch cavities early, monitor growth and bite, prevent bigger issues later. Teens, orthodontic changes, higher cavity risk from diet and hygiene, wisdom teeth monitoring. Teens often need closer follow-ups, even if they don't complain. And now adults. Stress, grinding, gum disease become bigger factors. Old dental work needs monitoring. Problems hide under crowns and fillings, and just because teeth look fine doesn't mean that they are. At this point, you might realize, okay, dental visits aren't just about cleaning, and you would be right. Now let's talk about what actually happens during a dental visit. Who needs more frequent appointments and why, and the biggest myths that families still believe, and how to create the right schedule for your household. Let's clear up a common misconception. A routine dental visit is not just a cleaning. A proper visit includes reviewing medical and dental history, examining teeth for cavities, cracks, and wear, checking the gums for early signs of gum disease, monitoring your bite, your jaw, and alignment, oral cancer screenings for adults, and x-rays when it's necessary. The cleaning part removes plaque and tartar brushing can't, bacteria that cause cavities and gum disease, and these visits are about prevention and early detection, not just polishing your teeth. When visits are skipped, small issues go unnoticed and quietly get worse. Not everyone fits into the 6-month model. Some people truly benefit from more frequent care. You may need visits every 3 to 4 months. If you get cavities often, have gum disease, wear braces or aligners, if you grind or clench your teeth, you have dry mouth, or you're pregnant, have diabetes or certain medical conditions, and for kids, this might include a history of early childhood cavities, poor enamel quality, high frequency snacking, orthodontic appliances. More visits don't mean something is wrong, they just mean your health needs extra support. Let's bust some of the biggest myths. Myth number 1, baby teeth don't matter. This drives me crazy. They absolutely do. They can affect speech, chewing, spacing for adult teeth, the child's confidence, and untreated cavities in baby teeth can also lead to infections. Myth number 2, if it doesn't hurt, it's fine. Pain is a late symptom, not an early warning. Myth number 3, dental x-rays are harmful. Modern dental x-rays use very low radiation and are taken only when needed. They help detect problems before pain or damage occurs. Myth number 4, skipping cleanings saves money. Preventive care is almost always less expensive than treatment. Skipping care often leads to fillings, crowns, root canals, or emergency visits. The best dental schedule is personalized. A good dental team will look at your age and medical history, past dental issues, lifestyle and habits, orthodontic needs, and instead of asking, how often should everyone go, ask, how often does each person in our family need care? That mindset shift will change everything. Okay, by now, you might be thinking, I see why skipping visits isn't as harmless as I thought. Next, we'll cover kids' first dental visits, how often children really need cleanings, and the biggest mistakes parents make, how dental care changes over time. And many parents ask, when should my child first see a dentist? The recommendation from the American Academy of Pediatric Dentistry is by their first birthday or within 6 months of the first tooth erupting. Why so early? Early detection of cavities in baby teeth, guidance on oral hygiene habits, advice on diet, pacifiers, thumb sucking, familiarization with the dental office to reduce fear in the child. Starting early helps kids feel comfortable and confident for a lifetime of dental care. The standard every 6 months rule is common, but it's not universal in children. More frequent visits may be needed when the child has a history of cavities or fillings, special medical needs, orthodontic appliances, poor brushing or flossing habits, sugary diets and frequent snacking. Less frequent visits may work for children with low-risk teeth, excellent hygiene, no previous cavities or gum problems. A pediatric dentist will assess risk and create a personalized schedule for your child. Even well-intentioned families sometimes get it wrong. Mistake number 1 is waiting until something hurts. Pain is a late sign. Problems often progress silently. Number 2, assuming that all cleanings are the same. Routine exams include more than just polishing. X-rays and assessments detect hidden issues. Mistake number 3 is not following the professional recommendations. Ignoring suggested follow-ups or recalls can lead to bigger problems. Each child's schedule is unique. Mistake number 4, focusing only on kids and forgetting the adults in the family. I see this all the time. Parents set the tone for the child's habits. Adults also benefit from preventive care and to model care for their children. Small adjustments in schedule and habits prevent problems later. Dental care is not static and it evolves with age. Teenagers need orthodontic checkups. They have a risk of cavities from braces or aligners. They need wisdom teeth monitoring. And adults, gum disease risk increases with age. Dental work from earlier treatment needs to be monitored. Oral cancer screenings start in adulthood. And for seniors, dry mouth and medications affect oral health. Gum recession, sensitivity, prosthetic and implant care. The takeaway, dental schedules should adapt and not stay fixed throughout life. At this stage, you probably feel more aware of why routine visits matter, confident that schedules can be personalized, ready to make informed decisions about every family member. And next, we will wrap up with adult dental myths, insurance and cost realities, and how to create a stress-free preventive schedule. A final reassuring conclusion. Even adults carry misconceptions about dental visits. Let's clear up the most common ones. Myth number 1, I'm an adult. If it doesn't hurt, I don't need the dentist. Silent gum disease, cavities under fillings, and enamel wear often go unnoticed until advanced. Myth number 2, I brush and floss, so I don't need checkups. Brushing helps, but tartar and hidden decay require professional care. Myth number 3, dental visits are just about cleaning. Exams catch early cavities, bite issues, gum disease, oral cancer, and even signs of systemic health problems. Understanding these myths empowers adults to prioritize preventive care, not just reactive care. Many families delay visits due to cost concerns, but here's what you need to know. Preventive care is almost always cheaper than treatment. Regular cleanings detect small issues early, avoiding fillings, root canals, extractions. Insurance often covers preventive visits fully. Check with your insurance carrier. Skipping visits to save money usually ends up costing more in the long run. Think of dental visits as an investment, not an expense. Here's how to create a practical, realistic schedule for your family. Assess risks, past cavities, gum issues, diet, and habits. Individualize. Children, teens, and adults. Everybody's different. Communicate with your dentist. They'll recommend visits based on risk. Consistency over perfection. Adapt as needed. Life changes, pregnancy, orthodontic, treatment. All of this changes the frequency we need to see the dentist. Let's recap the most important points from this video. The 6-month rule is a guideline, and it's not a hard rule. Most dental problems don't cause pain early, and prevention is critical. Schedules should be risk-based and not uniform. Nothing is cookie cutter. Kids, teens, adults, and seniors all have unique needs. Preventive care saves money, time, and stress in the long run. Regular visits are about maintaining health, not just cleaning teeth. Remember, dental care is a lifelong journey, and small, consistent steps make the biggest difference. If this video helped you, like it to help other families understand dental care. Subscribe for more tips on pediatric, teen, and adult oral health. Your family smiles aren't just about teeth, they're about confidence, health, and peace of mind. Regular personalized visits are the key to keeping smiles bright for a lifetime. Thank you for watching, and we'll see you at your next checkup. Bye!